Hi, this is the Anarcha Archive. I'm J.C. Hallman. When J. Marion Sims, the so-called father of gynecology, died in 1883, he was thought to have been responsible for a laundry list of medical advances. Over time, as his advances were either debunked or shown to have been the work of other surgeons, one final claim remained. He was the doctor who found a cure for vesico-vaginal fistula. In bonus episode number 2, we'll show that even this isn't true.
Whoa, 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 whoa.
It's not hard to find exaggerated claims about Sims' successes. Although Sims acknowledged that there had been others who cured what is more properly termed obstetric fistula before him, he certainly went out of his way to seize credit for the cure, and subsequent writers were only too willing to characterize him as a lone genius. Sims claimed credit for several aspects of the surgery: the so-called Sims position, the device he used to enable the procedure, and the use of a particular kind of catheter during the period of aftercare. Later, he would lay claim to the use of silver wire in surgery as well. Sims published all of this in an 1852 article that continues to stand today as a classic of medical history. But even in Sims' time, his own assistant in New York, Thomas Addis Emmet, noted that every aspect of Sims' so-called cure originated with other physicians. That's true, and it's easy to document. Accounts of fistula cures go back hundreds of years, but 4 of them, published close to 1852, are particularly relevant. In 1840, a doctor named John P. Mettauer of Virginia published an account of a fistula cure in which Mettauer first denuded the edges of a fistulous opening, just as Sims would later describe, and closed it with 6 metallic sutures. Mettauer used lead, and Sims would also try lead before turning to silver wire as suture material. As well, Mettauer employed a silver tube as a catheter, just as Sims would. In 1851, George Hayward of Boston reported numerous successes among 20 fistula surgeries performed over a period of decades. He too employed a silver catheter. In 1847, Joseph Pancoast of Philadelphia used plastic sutures and a gum elastic catheter, just as Sims did before he turned to metal material. Also like Sims, Pancoast left the sutures in place for 2 weeks or more. And in 1834, Montague Gosset of England put fistula patients on their knees and elbows and had assistants work to help bring the fistula into view, just as Sims would later do. And Gosset used gilt wire as suture material, and he would go on to use metal sutures in other surgeries as well, also as Sims did. Bear in mind, that last one, Gosset, appeared in print 11 years before Sims met Anarcha, and Gosset's account appeared in The Lancet, which may be the world's oldest and best-known medical journal. That said, there's a remarkable contrast. These earlier articles all tended to be small and did not include illustrations. Sims' article, when it was published some years later, also appeared in a popular medical journal, and it included 22 woodcut illustrations. It's not an exaggeration to say that Sims got the credit for a fistula cure because his presentation was elaborate and had pictures. Nevertheless, at this point, the challenge to Sims' legacy has succeeded in undermining almost all of his so-called successes. Even on the question of his fistula cure, Sims' apologists and defenders, and they still exist today, have been left arguing that Sims conceived of the first fistula procedure that was easy and produced consistent results. But that's not true either. Contemporary physicians complained that the procedure was difficult to perform even in the years immediately following the publication of the method, and it tended to be successful only when a fistula was perfectly positioned. Sims' assistant in Alabama, Nathan Bozeman, later indicated that the procedure worked only about half the time. And to top it off, I documented in an earlier video how Sims' clamp suture was abandoned only after 4 years. He published it in 1852, and by 1856, it was completely gone. The simple truth is that Sims' last remaining claim to fame was debunked many years ago. It lingers today only in the propaganda that appears in hagiographic biographical accounts of Sim's life that are published in academic journals, and in the falsehoods that have crept into journalistic accounts of his life story. The truth of the life of J. Marion Sims is much darker than it appears on the surface, and today it stands as a cautionary tale for doctors and for anyone who cares about facts, truth, and history.
Whoa,